I am so excited that you're hanging out with me today. And I want to thank you for choosing to listen to something that can really help you improve your fertility. I think that is super cool. And whether you have been here since the very beginning or you are a brand new listener, I want to welcome here. You are now a part of this PCOS fertility community. And we are a super smart, super empowered, really fun community that is committed to just blasting your chances of getting pregnant through the roof. And you are here now and you are a part of that. So thank you. Thank you for being here. Thank yourself for putting aside this time in order to be here. I'm Dr. Angela Potter. I am your host here, and I am also the creator of the PCOS Fertility Protocol, and I'm also a speaker. And I have shared the stage with leaders from companies like Google and Microsoft, and now I am here with you. And I am on a mission to help you get the tools and the expert answers that you need in order for you to have the best chance at getting pregnant with PCOS. And today, in particularly, it's really important that you're here if you have gotten dismissive advice from your doctor, like, oh, you're infertile, and the only way to treat your PCOS is to go back on birth control. Or maybe you've heard something from your doctor like, oh, just lose weight and everything will happen. And that kind of dismissive fertility advice is leading you to be so mad, so sad, so disgusted, stuck, and lost. And so it is really important if you've gotten that kind of advice in the past, because you are right now joining into this 4-part series that we're doing on this podcast. This is part number 2 of the 4 parts, all about PCOS types. And if nobody has talked to you about your PCOS type yet, then you are missing out on this huge missing link for your fertility. So just rest assured that if you have not gotten this before, it's really important that you get this, and you are here and you are in exactly the right place. Before we jump into today's PCOS type, I want to check in with you to make sure that you have picked up your copy of the PCOS Fertility Checklist. It's a free resource that I have created just for you. Just this week, I have updated it so it's even more precise. I've added the exact labs that you should be looking at with your fertility picture so you can enter which ones that you've had done, and then you'll know which ones that you need to. But this checklist is the 10 essential steps that you need to have in place in order to have the best fertility plan. So you can grab yours. Remember, it's just a totally free resource for you to pick up. So grab yours over at drangelapotter.com/checklist. I will also include that link in the show notes, okay? But be sure that you have that, because getting clarity on your fertility journey is something, when you are here in this community, that is what I'm helping you with, okay? And that checklist is one really important part of having this clarity for you to open up your chances of getting pregnant with PCOS. Okay, so we are in the second part of the 4-part series talking all about PCOS types. Last week, we talked about insulin resistance PCOS. This week, we are talking about adrenal PCOS. Now, I know that word is not something that you might be familiar with. We're going to dive into what it really means, how it affects fertility, what you need to do, all the things. But before we jump into specifics about adrenal PCOS, let's talk about the importance of figuring out your PCOS type. It is so important to know which type or types you have of PCOS, because it's like being handed a fertility roadmap. You can't get to where you need to go unless you know where you're starting from, right? So, let's just imagine together, I'll put out my cup of tea, that you're in this new town. You've rented a car, you're driving to this town, and you really need to stop for a coffee shop, and you're meeting somebody there. So it's a very specific coffee shop. And you're trying to get there, but you just know the name of the place and you know the address. And let's say, we're in a time where in order to get directions, you have to talk to somebody on the phone. And so you talk to this person, you say, "Hi, I want to get to this coffee shop. I'm trying to get there. I'm meeting someone there. Can you tell me how to get there?" And the person on the phone says, "Well, yes, of course. Like, I know that coffee shop. It's just right in the main town next to the grocery store." And you're like, "Well, I'm new to town. I don't know how to get there." What are they going to say next? They're going to say, "Well, ma'am, where are you right now? I will help you get there." And you might say, "Well, I don't know where I am because it's dark out and I can't see any signs. I'm running really low on gas and I have to get to this coffee shop. So I don't really see any markers around me. I've come off the freeway. I've made a few turns, so I can't really tell which direction I'm in." And they're like, "Well, can you see anything? Are you around houses?" And you're like, "I can see a couple houses and some fields." And so you just go on this long conversation trying to figure out first where you are, because the end goal is obvious. You know which coffee shop you need to get to. The operator that you're talking to that's trying to get you there is like, "I know exactly where that is. Yes, let's get you there." The hardest part is figuring out where you are in order to get you to your goals, right? And it's so obvious when we are looking for directions. We know that we've got to first know where we're starting at. And this is an essential part of health, and particularly fertility health, and it gets completely missed. And so that's why it's super important that you're here today to understand the importance of figuring out your PCOS type. Because once you know your type or your types, okay, you could have more than one, then you know where you're starting from. There's a few other essential pieces of your health that you need to know, specifically your PCOS diagnosis and then your PCOS type, to get this clarity of where you're starting from. And so then once you get this clearer picture of where you're starting from, then it just lays out in front of you a path to then reach your goal. Okay, so that's why understanding your PCOS type is super important. Now, here's a few more logistics about PCOS types. There are 4 of them. That's why we're doing this 4-part series. Each podcast over these next few weeks is covering one of the types. You could fall absolutely just into one of the types, and you are absolutely insulin resistant PCOS, and you have no other parts of the other ones. And so you're just one type. You could be a mix of 2 of the types, or 3, or 4. And here is another important takeaway when it comes to PCOS types. It doesn't matter how many of the types that you fall into. What matters is that you figure out which type you are, or types, so then you get that clarity moving forward. So then you can get a fertility plan that is specific to your body's needs in order to open up the best chance of getting pregnant. Because PCOS in particular does not respond to this one size fits all, let's just throw you in a box kind of treatment plan. If it did, everyone with PCOS who wanted to get pregnant would be pregnant right now. Am I right? Okay. We know that the fertility medications out there, as much as they do help certain people or are helpful in certain situations, they are not the golden ticket. Okay. We know that IVF is not the gold standard for fertility. Again, if it were, everyone would be pregnant that wanted to be. And with PCOS, because it is a syndrome, it's made up of a few different symptoms that create the PCOS syndrome. It shouldn't be expected that one medication is going to fix everything that is causing fertility struggles with PCOS. And that's why it's super important. You've got to take this step back to understand globally what's going on with your health, with your body, where you're starting from, and why that's so important in order to get you moving forward with your goal on an effective fertility plan. So today we are talking about adrenal PCOS. Last week we talked about insulin resistant PCOS. If you are surprised that insulin resistance is one of the PCOS types and it's not just for everybody who has PCOS, then I want you to jump over and listen to insulin resistance after this episode, okay? Because I really dive into what it means, what it looks like, some lab tests and symptoms for how to know if you have it, okay? But let's just dive into adrenal PCOS. What do I mean when I say adrenal? Adrenal refers to your adrenal glands. These are two tiny, tiny little glands that sit on top of your kidneys. And one of their most important jobs is to put out your body's cortisol. What is cortisol? Cortisol is your body's stress hormone. And it's a really important hormone, actually. If you have heard of cortisol, you may have heard it has a pretty bad rap. And people are like, you got to bring your cortisol down, 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 which is true. And we're going to talk about that today. But cortisol has some really important functions in the body, okay? It helps you wake up in the morning. It is a hormone that gets you out of bed. It's like, all right, the day is here. Your life is in front of you. Let's get out of bed. Let's get going. It is a hormone that helps regulate your blood sugar levels. And if your blood sugar levels fall too much, cortisol is the hormone that starts getting you moving and saying, hey, alert, alert, we need food because your brain isn't going to work anymore. We need some glucose running through our body. You need to go eat some food right now. Okay. And that's an important survival mechanism for your body. Cortisol loves you and wants you to thrive and be healthy. And it gives these alert signals that are really important. And unfortunately, in modern society, we are living in a world that is not in line with our natural cortisol rhythms. That was a really vague sentence. Let's dive into what that means. So, your cortisol has this nice, beautiful rhythm during the day. I mentioned a minute ago, it's the hormone that wakes you up. So, it is highest in the morning because it's getting you going. And then it steadily falls throughout the day, has a little blip in the afternoon, and then falls pretty dramatically at nighttime when you should be going to sleep. And when the cortisol falls, then your melatonin can rise, okay? Your melatonin, your sleep hormone. And so that's this just beautiful natural rhythm that cortisol has throughout the day. That's what it wants to be doing. That's what it's doing in many, many people's bodies and has been doing in our bodies for millions of years. Yes, researchers know that our body's output of cortisol and our response to the cortisol output is the same as it always has been. And here's why this is important for your fertility. So let's say 150 million years. Imagine you are an early human and you live out on the plains and you're out, foraging for food. And all of a sudden a tiger you can see it in the distance. That is very scary, right? And so you are going to run and to get away from that tiger. At that moment, your fight or flight response is triggered, which means cortisol is going to just be pumping through the body. And that's going to move your blood flow to your hands, to your feet, so that you can just keep running. And you run, 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 run. Thankfully, there's, a group of trees. You run up a tree. The tiger has, seen an antelope or something, and it doesn't chase you up the tree. It goes the other direction. and you watch it disappear in the distance. And oh, you're in the top of this tree. That tiger has gone. Your heart is beating. You can just see it boom, 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 pumping through your chest. And you just take a couple deep breaths. Oh my gosh. Okay. That was really stressful. And now that tiger is gone. Thank goodness. And so as you sit there and take those deep breaths, right, you're changing the hormonal pattern inside your body and your brain's chemistry, that what's telling your body, okay, your cortisol is actually coming down. And the act of running and climbing that tree has helped your body metabolize that cortisol, right? Like get it through your system. And so then you climb down the tree, you go back to find your family, and you enjoy that peacefulness until there's going to be another, animal or invader or whatever. But it's this very much this pattern of significant stressor and then relaxation, staying at the middle point, and then stressor, and then that cortisol goes away and you come back to your midpoint. That is a very healthy way to respond to stress. Now, fast forward to modern day, where we are just exposed to stressors all the time, right? I'm talking about, the being in the car, in traffic, and you're hungry, and people are cutting in front of you. You're trying to think about what's for dinner, and you need to stop at the grocery store, and you need to pick up the dry cleaning, and you're annoyed with your spouse, and your best friend called and had to cancel plans, blah, blah, all these things happening in front of you, and we're just constantly exposed to all this stress. And our bodies are producing the cortisol because it's like, oh, wow, stress is here. And important note here, your body cannot distinguish between a bear or a tiger coming at you versus, not getting that job interview that you were trying for. Your body doesn't understand that external stimulus, but internally it's going to respond with cortisol in the same way. And so in our modern world, we are finding that when we are constantly exposed to this cortisol and we aren't adapting to that stress around us, then that can lead to cortisol being imbalanced throughout the day. It could be really low, honestly, for somebody who is in this adrenal fatigue state for years and years. It could just flatline. Most commonly, I see it elevated. And so you're in this state where, because you can do a test, which we're going to talk about more in just a couple minutes, but you can get the test back to see what your cortisol levels are doing throughout the day. And if they are elevated, then you're going to be constantly on this feeling of, jitteriness, anxiety, like high alert, even when there's nothing happening out there. And you're just constantly feeling like something is about to happen. Well, that could very well be your cortisol levels are too high. So let's swing this back around. Adrenal PCOS, which is the PCOS type we're talking about today, is about stress. It's about cortisol. And how does this affect fertility? Well, our hormones are talking to each other. Cortisol, that you've been learning about today, is a hormone. A lot, we talk about them separately. Like I have not talked about thyroid hormones today. A lot of times thyroid's just talked about as the thyroid. Then there's cortisol. We have a variety of hormones, your reproductive hormones. But guess what? The whole hormone system is a group. It's called the endocrine system. So all these hormones are messengers in the body, and they are talking to each other. So when one hormone system is out of balance, you've got to look at the other hormone systems to see how is this one affecting downstream these other hormones. And if cortisol is elevated, okay, in that really classic way that I see it very commonly with PCOS fertility, That elevated cortisol, it then causes insulin to rise, which then increases testosterone, which shuts down ovulation. Cortisol can be one of those things, if you've got it constantly running through the body, it makes you hold on to excess weight or makes it hard to lose weight, which then affects your insulin levels, raises those testosterone levels, shuts down ovulation. Cortisol can impact progesterone levels. It can lower progesterone levels, which affects ovulation. And even if you are able to ovulate and get pregnant, if you don't have enough progesterone to keep that pregnancy going, well, then you have a very high chance of miscarrying. And that's not what you want. And so if you're in that space where you haven't been able to keep a pregnancy going, is somebody talking to you about your cortisol hormone? Is somebody able to take a look at the hormonal cascade and the variety of hormones that are affecting progesterone or your ovulation to understand what is this global picture in your specific body that's affecting fertility? Because that's the number one thing that I talk with women about. One of the number one frustrations is that their doctors aren't listening to them or they're dismissing their symptoms. They are just saying that weight loss is going to fix it, or if they have irregular periods, just to get back on birth control. Well, guess what? That doesn't work. Just focusing on weight loss doesn't support this global holistic picture of what's going on in your health. Just getting back on birth control actually shuts down your body's innate production of hormones. It might look like it's a regular period because you bleed once a month, but no, that it's just shutting down your body's own natural hormones. It's not doing anything to actually balance those hormones out. So you need somebody who can look at this picture for your body. And this is why the PCOS types are that important. So how do you know if you have adrenal PCOS? Well, testing is going to be the most straightforward, most obvious way to know if you do. You know by now, I am a big advocate of getting tests done because they are a concrete way for you to see what's happening in the body. Also a really great way for you to then communicate with your spouse or your partner or, your family, whoever's helping you. Say, look, this is what's happening with my labs. This is why I am not able to get pregnant. And this is why I need to do this work. Okay. So you can get testing done. It's a salivary test. It's a test where you do 4 samples over one day. And you send those into the lab. This is a lab that it's a kit that's sent to your house. So you just do this at home, in the comfort of your home. You don't have to go to a lab to do your samples. No, you're at your house. And then you've got this pre-made envelope that you put the samples in, you pop it in the mail to the lab. And the lab is then going to analyze your samples and send you back this really cool result. And it'll give you your levels. But what I love about it is that it'll give you the graph. And so it'll graph what a normal cortisol rhythm should be throughout the day. And then it will put your points from your samples on that graph. And then you can see if it's really low or really elevated and where it is throughout the day. And so getting that test done is the easiest and most effective way to know what your cortisol is doing. You can also go based off of symptoms depending on how your mood has been, how much stress you've been under over the past few months, few years, how you're sleeping, things like that. The issue with just going off of symptoms is that there are certain nutrients and herbs that are used to support the cortisol output to push it down. And if you were somebody already with low cortisol and then you get serifos, which lowers cortisol even more, then you're going to feel hungover the next day and you're just not going to feel good at all. And I don't want you to be feeling like that. So, getting the test done is really the best way to understand what your cortisol is doing, how far into this adrenal fatigue you are, and what you need in order to then bring your body back into regular balance. Because that is a possibility. Oh my gosh, like getting the cortisol back into regular balance is one of the easiest things that I do with patients over my years of practice. And you've just got to know how to put the pieces together. You've got to know what nutrient levels are low. Like, let's talk about vitamin C. Your adrenal glands are using the highest concentration of vitamin C in your entire body. So if you're deficient in vitamin C, even just a little bit, your adrenal glands are going to go, what in the world is happening? Okay. So you've got to know about certain nutrients, and you've got to know how to put together a plan that is safe for preconception and supports cortisol to come back into regular rhythm. It's really cool the way that we can use nutrients and herbs to be able to do that. And what we're doing is helping the body adapt to the stress around you. So then, you still have the same daily things that are happening, like the job and making dinner and having to run all these errands and all of the everything with life, but you're able to respond to it better. And that's really cool. Sleep can get better. I hear this all the time that people are sleeping better. And that's because that cortisol is naturally going down at night as it's supposed to, allowing melatonin to rise. And melatonin is our sleep hormone, but it's also a really important antioxidant for egg quality. Okay, so as we're talking about adrenal PCOS, I want to just put in a note here that I am not talking about Addison's and I am not talking about congenital adrenal hyperplasia. Congenital adrenal hyperplasia is one of the conditions that your doctor should be ruling out for you because it looks like PCOS sometimes. Simple test in order to see if that's what's going on for you. And many doctors just already include that in their fertility workup. But I just want to be hyper clear that I'm not talking about treating those specific syndromes. Okay. So you need to know what your cortisol levels are doing throughout the day to see if they are impacting the hormones that are helping you make a baby. You want to get testing done to see what that cortisol is doing throughout the day. So then you can get that treatment plan, that fertility plan that addresses what's going on in your unique body. And you need a plan that helps get your cortisol levels back into regular rhythm. So then that hormonal cascade can happen, insulin levels can come down, testosterone can come down, ovulation can improve. Here's what PCOS and adrenal health and stress does not mean. It doesn't mean, hey, go meditate for an extra 10 minutes every day and everything's going to work out. Now, there's really good research behind meditation. It has a bountiful amount of benefits, but often I see meditation used as just a little bit of a dismissive advice for fertility. And it can be dismissive in that place of, okay, just go meditate. And if you can do that for 10 minutes a day, then your stress will go away and you'll be able to get pregnant. And, if somebody tells you, relax, it'll just happen, you just want to punch them in the face, right? So that's not at all what we're talking about with adrenal PCOS. No, it is actually about getting a plan that helps physiologically what's happening inside your hormones to shift so then you can adapt to the stressors around you. And that's why it is super important to understand your PCOS type and to work with a provider who is able to put together these PCOS pieces for you. All right, so thank you so much for being here. I will see you next week. We are going to cover inflammatory PCOS. And As we finish up here, if you are enjoying this episode, I would be so grateful if you could just pop over and put in a positive review, because reviews just mean the world to me and this podcast. And they also help other people who are looking for this information to be able to find it. And I also want to remind you that this podcast is only for informational purposes, okay? It should not replace any of the medical advice that you are currently getting from a provider. And if you feel like you aren't getting the PCOS fertility answers that you are looking for, then you are more than welcome to reach out to me and I can talk with you. How to work with me is to sign up for a PCOS fertility breakthrough session. It is a free session where you and I chat on the phone. I'm going to help you just put together the pieces, get the clarity you need, figure out what's missing, and figure out what needs to happen in order for your chances to open up. So I would be overjoyed to talk with you. You can sign up for one of those at drangelapotter.com/PCOS. I will include that link in the show notes. But as we wrap up here this week, I just want to say, in case nobody has told you today, that I believe in you. And I believe in your ability to find the fertility answers that you're looking for. Have a beautiful day. Mwah.